You have said that this election is our last chance to get single-payer health insurance. Why do you believe that?
Well, I think that really what we're talking about is, first of all, the national bill, which we didn't talk about very much, but the national bill is going to kick in 2014. And in 2014, it puts in these healthcare exchanges, which is sort of where people can go in who have individual health insurance and purchase health insurance. And those things are actually mandated in 2014. It will be very difficult for us to do single payer if we wait that long. If we do single payer ahead of time, Bernie Sanders has vowed that he is going to go to Obama and ask for an executive order to allow Vermont to enact its single payer system, which would allow us to actually be out of those exchanges. So what I'm saying is that we currently have wonderful senators and a representative who will work for us to try to get these waivers. We have Dr. William Hsiao, who's now working, developing the systems. What we need is leadership in the governor's office to push this along. And that is why I said this is really our last chance, or our best chance. It's not our last chance, it's our last chance for a good long while if we don't get this in before the 2014 deadline, when it'll make it very difficult for us to get it done. So we certainly need to get this done soon, and that's the advantage of having Dr. Hsiao and Bernie Sanders and Senator Leahy and Congressman Welch.
So you're working on Peter's campaign?
I have been helping Peter, yes I have, as an individual, not representing any organization. And there are many physicians throughout the state that are supporting Peter, because we all believe that we really need a rational healthcare system, and we need leadership to get there. And you know, at this point, we're not seeing very much leadership in that area on the part of Brian Dubey. I think his is sort of a sit back and wait and see what happens kind of attitude about healthcare. And so many physicians and nurses and nurse practitioners are getting behind Peter for that reason.
One other question. We got into the cost of medical education a little bit before, and you said that a state like Vermont could not make medical education free. But I believe in the medical school at UVM, an out-of-state resident pays more than a Vermont state resident. So I don't see why a resident of Vermont couldn't pay zero, while an out-of-state resident would pay the going national rate.
It really depends on how much money we're really talking about as far as, you know, the medical education. And I think it would be a challenge for Vermont to be able to do this. However, with that said, when you're talking about saving millions and millions and millions of dollars on administrative costs, we could funnel more money into medical education and train more nurses and train more doctors and give them certainly a reduced rate on their tuition. There would be more than enough money to do that. We'd also have money to retrain displaced workers in the administrative area, so people who work for insurance companies and are doing billing in the hospital sector. This is an enormous amount of money, as we said, that we're spending on health care. We're just spending so much of it is wasted. 31 cents of every healthcare dollar pays for transaction costs, administration, paperwork, and profit. At least half of that is unnecessary. So we certainly would have more money that we could do that. I think it would have to be done mostly, though, at a national level.
Well, it's been very interesting talking to you and Peter.
Very nice talking to you, too.
I want to thank you for coming.
Yes.
And,
happy to be here. Great.
And I'm going to do everything I can to get Peter elected also.
Wonderful. Great.
And for those of you at home, thank you for tuning in. And I hope to see you again next month for another edition of Vermont Today.